Hey guys, today we're going to talk about exercise for senior adults, and I'm going to just jump right on into it. I hope you guys are watching these things because it is going to give you some guidance, as far as what's coming on the test and all that sort of thing. So let me jump right in and share my screen here. All right, you got my PowerPoint up here. As I said, we're going to talk about exercise and what's appropriate, what's inappropriate, all the same sort of format as we've had for the other courses, the other chapters so far. So just follow along and you'll have this down pat by now if you've been watching these guys. So when we're talking about aging, there's some terms here at the top that you kind of want to know. You've got gerontology, which is the study of the aging process. And then two things that are very important: your chronologic age or chronological age, and that is your actual age in years. And then you have your biologic or biological age, which is the age of your body based on the level of performance of your body systems, like how healthy your heart is, how healthy your lungs are, what sort of cardiovascular condition you are in. You've probably taken tests before on the internet that tells you what your mental age is or something like that. It's kind of similar to that. As it says in huge font here at the bottom, chronologic and biologic age are not necessarily the same, and they rarely are. Usually, in most cases, someone's biological age will be higher than their chronological age. So everything that you do that contributes negatively to your well-being is something that would add to your biologic age. So smoking is going to add to that. You may be, if you're an obese smoker with diabetes and you're 42 years old, your chronologic age is 42, but your biologic age may be more like 60. So hopefully you understand the difference between those two. You do need to know that for sure. So there's some of these are just the things that kind of influence your biologic age that we talked about, things that influence your overall health. Have you had adequate water intake? Are you eating well-balanced meals? Do you sleep regularly and adequately? I can tell you from there, my mine has just risen a little bit because I don't sleep as much as I should for sure, nor do I do the next one, engage in physical activity as much as I wish I could. I have been eating very healthy lately and have lost some weight, so that is a bonus. That probably lowered my biologic age back down. Avoiding tobacco use, limiting or eliminating alcohol, maintaining a healthy body weight, and decreasing stress levels. You can see how all of those things affect your well-being, your health, and your biologic age. None of those things affect your chronologic age, okay? So some changes that happen anatomically and physically in the body as you age. As far as your integumentary system, which is your skin, you've got different layers there: your epidermis, dermis, and hypodermis. They all become thinner. Your dendritic or Langerhans cells suffer from UV exposure. Your skin is starting to get sunspots and things like that as you get older. Melanocytes diminish and become less active. The number of nerve receptors declines, so you don't get quite as quick a response from a painful stimuli. The number of sweat glands change and actually decreases, and the number of blood vessels diminish. It almost seems sad. As you get older, some of your blood vessels almost just kind of dry up like a creek bed. Your main ones aren't going to do that, obviously, that are going to, function with your lungs and heart and giving your main organs the blood and oxygen that they need, but some of these smaller capillaries out in the external regions do start to diminish. So when we're talking about these changes to the skin, some things that are consequences of this, you see that people become more prone to injury. I had a grandmother that fell, and where I would have gotten a scrape, you know, a raspberry on my elbow, she ripped her skin just wide open like a wet paper bag almost, and that's gross. But it's, you know, your skin becomes very thin and brittle. Um, it's slower to repair. You become more susceptible to infection, and you're unable to regulate your body temperature as much mainly because your skin is thinner, each one of those layers that we talked about. So you're not holding in warmth as well as you can. You don't have that insulation that keeps you warm or keeps you cool. You just can't regulate it as easy. Also, the skin, as we all know, as we age, it becomes likely to wrinkle. As far as your skeletal system, you see a diminishment in your bone mass. Bones will become more brittle. As far as your discs in your back, it made my back hurt when I read this. Your intervertebral discs start to compress. People actually, there's been studies, it really doesn't take a study to tell you this, as you get older, people start to become a little bit shorter. And that's because of this compression of the intervertebral discs. Also, some of the meniscus in the knees and other weight-bearing joints are starting to wear away and become a little thinner. That can also play into that, which is in the next one. Your articular cartilage, which is in between joints, begins to wear away. Sprains, bursitis, and arthritis become more common as you age also. If you notice, there's a trend here. Most things that we're naming, if we go to, you know, when we look at testing on this chapter, notice that most things are becoming less, smaller, diminishing. Almost everything that, you know, skin is thinner. Blood vessels are diminishing. Your bone mass is becoming smaller. Your intervertebral discs compress and become smaller. Your cartilage is wearing away. So that's a theme for most things that we'll talk about in this chapter. Know the difference, know what a sprain is. Sprains occur when connective tissues associated with joints are overstretched. Bursitis occurs when bursa sacs associated with joints become inflamed. Those are, you know, have a lot to do with the smooth movement of your joints. It happens in elbows, shoulders, other joints as well, but bursitis becomes more common, and that's from the inflammation of bursa sacs. Arthritis occurs when joints become inflamed. There's a couple different types of arthritis. Osteoarthritis is the most common. It's also known as degenerative arthritis. When you start having your cartilage and all break down, you start to have some damage happen in the joint. So long-term use on these joints starts to wear away at your articular cartilage. That loss of cartilage is going to lead to the exposure of bone surfaces, which is going to lead to damage and cause osteoarthritis. This is just a picture of kind of what's going on with it. Your cartilage is beginning to be damaged, and you start having some calcification and things taking place in there. So when you see these jagged edges, that's not going to move as smoothly upon each other as they would normally before this started happening. Second type is rheumatoid arthritis. It's an actual autoimmune disease. Doesn't have to do with overuse. In this case, the immune cells attack synovial membranes. The synovial membrane, what it does, it produces a synovial fluid, which is kind of like lubrication for your joints. When you have issues with the synovial membrane, the fluid will become more grainy. Obviously, you think of like sandpaper is grainy. So if you add grain in there, grit, you're going to see some damage start to happen to the cartilage. So rheumatoid, know the difference between osteoarthritis and rheumatoid arthritis. Rheumatoid is autoimmune, osteo is more common, and it's from overuse. So remember that. As far as your muscular system, the number of blood vessels, myoglobin, and mitochondria start to drop. So you're just going to see decreases in function to a degree. Your number of muscle fibers or myofibrils are going to decrease. Glycosomes disappear, and your number of fast and intermediate fibers decrease as well. So your reaction times and speed movements are going to slow as well because of this. Your nervous system, your number of neurons in total decreases, it drops. Neurotransmitter levels decrease. Your brain size actually diminishes as you age, once you hit a certain point. Memory, hearing, balance, vision, smell, and taste acuity are also impaired. Doesn't getting old sound like fun? I'm older than all you guys, and I'm starting to see little bits of this. You know, I don't have my glasses on right now, but I probably should, because now my balance is definitely can be affected when I don't wear my glasses. I start to get kind of woozy. So my vision, I've seen a little difference in it already. No problems with smell and taste. Memory's always been bad. Hearing, still okay. I think I hear what I want to hear. That's what my wife tells me anyway. Your reflexes begin to slow. We talked about that already, and that's based on the decrease in neurotransmitter levels as part of it. The changes in your musculoskeletal system have an effect on this too. You've lost some of your fast fibers in your muscles, so that's going to slow your reflexes as well. Your endocrine system, some changes. You see activities in the different glands and the sizes of the glands. You're going to see some changes, and they're listed here, some of them that are affected: your pituitary, thymus, parathyroid, your pancreas, and your pineal gland. They're all kind of affected in time as well. Your cardiovascular system, you're going to see your changes happening in your blood vessels. Your blood vessels develop plaque, and that happens normally, and it's maybe already started in some of us. It just gets worse, and the buildup becomes more prominent as you get older. Your arteries become less elastic. You know, our vessels are supposed to be kind of stretchy. As you get older, the stretch isn't as prevalent. They're not able to stretch like they were before. The valves on your veins start to weaken. So that's where you may have some leakage of fluids, swelling, edema, things like that. That's because of these valves weakening, and you have a little bit of backflow sometimes. Your valves kind of direct things the direction they're supposed to go. Your total number of blood vessels diminishes. Blood pressure tends to increase primarily because of the fact that your arteries have lost their elasticity. They're not able to stretch. So you think about putting fluid through a tube. If the tube is stretchy, the pressure won't be as much. If the tube is not stretchy, it doesn't have any way to release any of that pressure, so the pressure would increase. That's what's happening, causing increases in blood pressure with age. As far as the heart, we're still talking about cardiovascular here. The elasticity of the heart wall decreases, so you've lost elasticity there. Your heart valves thicken, and your heart can either atrophy or hypertrophy, and that's either it can get smaller or larger. Atrophy would be getting smaller, and hypertrophy would be getting larger. You've heard of people having an enlarged heart, I'm sure. far as respiratory system, your coughing reflex slows, makes you a little bit more prone to actually taking in and keeping in germs and such, because if you're not coughing some of these things out, they kind of stay in you and can become a problem. Your macrophages in your lungs become less active. Those are things that help keep us from getting sick also. Take away things that we don't need to have. Mucus will begin to thicken. The number of cilia, which are the little fingers that work with getting oxygen and all that, drops. Other changes, they're directly proportional to exposure to environmental pollutants. You know, smog. If you were a farmer or something that worked with chemicals all your life, you're going to have some respiratory system consequences from being exposed to chemicals or things that aren't good for your respiratory system as you age, obviously. Lymphatic system, your thymus shrinks, your T cells become less active, so you're a little less able to fight off infections and such. Same thing is caused by the slowing of macrophages. This makes wound healing be delayed. You have less ability to develop fever, which sounds almost like a good thing at first thought, but fever is the body's natural way of fighting off infections and such. So if your body's unable to do that, then you're going to need more help than you would when you were more able to develop fever. Inflammation occurs frequently. Swelling, inflammation, it's pretty bothersome, and it starts to become more often within the lymphatic system with age also. Again, doesn't this aging thing just sound like so much fun? I'm not looking forward to some of this, especially when I look at the top of this next slide. Teeth are lost, gums become inflamed. Medications can interfere with absorption. We're talking about digestive system here. Your digestive tract lining is going to thin. The ability to produce secretions, which have to do with, you know, the peristalsis and things being broken down in your digestive system. Without the secretions that are necessary, you start to have issues with your digestion. Lactose intolerance, actually the chance of that increases with age. So what is lactose intolerance? It's just the inability to digest lactose that's found in dairy products. It remains in the GI tract and attracts water. And when that happens, you're pulling in this excess water into the GI tract, gastrointestinal, you're going to start having cramping and bloating, which at that point, bacteria start to ferment this lactose and produce gas. So it'd be a lot of fun to be around, obviously. Lactose intolerance promotes bone loss if people don't find other sources of calcium and vitamin D, because you got to get it somewhere. If you're having trouble digesting lactose, you're not going to want to take in dairy products. So you got to find it other places to stay healthy. So how do we manage lactose intolerance? You're going to consume dairy products in moderation, eat other food types along with dairy, you know, to kind of buffer the dairy that you take in. There's enzyme tablets that can be taken with meals, enzyme-enriched foods, consumed fermented products like yogurt. They're already fermented, so you're not going to have the issue of them trying to ferment and cause this issue. And someone with lactose intolerance really does need to read food labels, because lots of products contain lactose and they may not know it. It may not be just cheese that you know is going to have lactose. It may be some other items. Urinary system. Kidney size diminishes and nephrons are lost, so the ability of the kidneys to remove waste from the body is going to diminish because of this. I mean, that's the main reason that our urinary system and kidneys are there, is to remove waste from the body. also directs the things that we need to reabsorb, such as water, glucose, and there's other useful things that we're supposed to be reabsorbing. That is cut down through time. You start to see that the urinary bladder loses elasticity as well. So seniors start to become less sensitive to the fact that they need to pee or void, as they have here. That's why you start to have trouble with incontinence sometimes. You see, commercials for Depends and things like that. They may not really feel that they need to pee, and the next thing you know, you're peeing. So I know that's kind of hard to explain and hard to even fathom right now, but it's something that can happen for sure. I may have clicked this on accident. No, we're good. Reproductive system. In the male, you're going to see enlargement of the prostate gland. That's very common. The risk for prostate cancer increases in males as they age. Testosterone levels actually stay fairly stable. And what that does, it protects bone tissue and maintains secondary sex characteristics. That's why you see less osteoporosis in men than you do in women. I apologize. I'm going to take one moment to check this phone, and I will answer back shortly. In the female reproductive system, the ovary structure changes. Their monthly cycle is affected. Hormone levels are affected as well. Estrogen levels drop significantly after menopause, and what this does, you're going to see an increased risk for heart disease and osteoporosis, and possibly some impairment to immune system functioning as well. I will be back to carry on with this in a bit. Okay, my apologies. I'm going to go back to share my screen. I had to cut loose to answer something real quick. All right, so here we go. I think we finished this slide. So all the things that we've named, some things that you need to watch out for during exercise is the inability to regulate body temperatures. Because of the loss of blood vessels, you're unable to cool, radiative cooling. Also, you're unable to cool as well because of the loss of sweat glands that's happened. You're not able to sweat and cool off via evaporative cooling. And your loss of subcutaneous fat, which is just fat under your skin, impairs heat retention, so you become cold easier. So you see where there's issues on both sides as far as regulating body temperature. There's loss of range of motion. The spine loses flexibility and stiffens. I've got some of that now already at my age. Articular cartilage wears away. You're going to have inflammation be a problem. Arthritis could be an issue. We talked about how synovial fluid production slows. There's a decrease in lean tissue, which is muscle. This is known as sarcopenia. You need to know that term. And it's obviously when you lose muscle, you're going to lose some strength. Balance. You see a loss of balance happen with age also, so it's something to watch out for during exercise. The balance issues, they come from different areas, really. You've got loss of muscle mass, weakened joints, and decreased flexibility. They all come together, and it promotes, loss of balance. A lot of times stiffness, if someone loses their balance and they're not flexible, able to make adjustments to keep themselves from falling, that's where you see these balance problems actually promote falling, is when you're unable to flex and move quickly enough to regain your balance or your footing. Obviously, more falling equals more broken bones. Falling often is going to result in that. You're going to see decreases in cardiorespiratory functioning, which talks about, that's talking about our heart and our lungs and how the functional ability in our body is tied in with that, because the ability of the heart overall, its functional ability declines. Your maximal heart rate is going to drop. The ejection fraction is going to decrease. You'll see rises in blood pressure, and your VO2 max actually decreases with age as well. So there's barriers to exercise for every group. Some things that have been found to be barriers for elderly is fear of injury, lack of knowledge, actual lack of transportation to a facility if they're unable to drive or don't have a vehicle, lack of skills, abilities, and confidence. You can see how all of these really would be the case with the elderly. Physical limitations resulting from disease and limited income. You know, they may not have the money to join the Y or Anytime Fitness or wherever. It may not be as easy, and everywhere is not as lucky as here in Oxford. We've got a wonderful park commission that I used to work at, and I used to be over a group called Leisure Lifestyles, and it serves people that are 50 and over. And we had classes everywhere from Tai Chi, yoga, Pilates, aerobics, Zumba, all sorts of different exercise that were available free of charge to people that are in this time frame that we're talking about. So it's very helpful for people here in this general area. So what benefits do we see? We always look at what the contraindications are. What are the benefits that, you know, we want to know positives too. You're going to see reduced risk for chronic diseases, better management of existing health conditions such as, say, diabetes, high blood pressure, things like that. Improved functional capacity. You're able to do everyday things easier. Improvements in flexibility and balance, which means less falling. Improvements in mental health. That's another thing. Exercise has those feel-good hormones in it. Also, when you complete exercising, especially if you're elderly and you don't know if you can do it, if you get something done, you're going to feel better about yourself in general. You know, you have a higher self-esteem, so that's a bonus also. Exercise testing, as far as that goes, most seniors don't have to have exercise testing before starting just a moderate intensity exercise program. If they want to go to the park commission and walk on the track, they wouldn't necessarily need to have exercise testing first. Not going to ask you a bunch about this, but just for your information, it is here. When indicated by a physician, you're going to use standard testing procedures for generally healthy seniors. What that is, they usually do an initial workload of less than 3 METs, with incremental increases not exceeding 0.5 to 1.0 METs if low work capacity. METs, you're talking about this 0.5 to 1, that's about like you sitting in a classroom. So it just goes up incrementally from there. 3 METs is not a huge workload, obviously. People that have balance issues, they can be tested on a bike or cycle ergometer. You want to avoid exercise testing for people that are over 75 unless it's medically indicated. So, and like I say, most of the time we wouldn't be the ones doing this exercise testing unless you worked in a, you know, a cardiac rehab sort of area or something like that. When to stop exercising? What do we see that tells us, whoa, gotta stop what we're doing? If systolic blood pressure drops by more than 10 from the baseline, despite an increase in workload, it actually should be going up because your body's working harder. Severe angina, which is chest pain, develops. Dizziness, incoordination, or loss of consciousness occur. Obviously, I think you probably should stop if your person loses consciousness. Cyanosis or pallor develop. That's when you feel, usually someone starts looking kind of blue, very pale, just not looking good. If the subject requests to stop, you need to stop. Or if there's a sustained ventricular tachycardia that happens, that's a heart rhythm disturbance that continues. And I'm going to stop again, and I'm going to finish this tomorrow and post it then, hopefully. That's going to be my goal. So sorry for the interruptions in this one, but it'll be okay, and you'll have this to watch if you choose. All right, let's get back at it. It's still today, not tomorrow, but let me share my screen again. All right. As far as cardiovascular training, like I've told you guys before, I'm not going to ask you tons of specifics about these numbers, but this is good information to have and keep moving forward if you're planning on working in an exercise setting, because it does tell you some general ideas of what you can do with people that are in each of these special populations. So obviously, you want to start with 10 minutes at least of low intensity activity. You want 30 to 60 minutes of moderate aerobic activity. As you see, a rating of perceived exertion, RPE, of 5 or 6 on a 10-point scale, 10 being as hard as you can go, 5 days a week. So that's pretty good bit of aerobic activity we're talking about. Now, that doesn't necessarily mean doing aerobics. We're just talking about aerobic activities. If high intensity activity, where you're talking about working at a 7 or 8 out of 10, then that you could do 3 times a week, 20 to 30 minutes per session. You want to avoid activities with rapid changes in direction. Why? Correct, because we have problems with falling. We also want to avoid high impact activities. We've talked about how bone density is decreased and things like that. So obviously, high impact activities, you probably don't want to start a geriatric football league or something like that. Just a thought. Resistance training, you want to start out with 40 to 50% of one repetition max rep. 40 to 50% of what they can do. Progress to 60 to 80% of that is tolerated for 1 to 3 sets, at least 2 days a week. So again, these are numbers I'm not going to test you on, but it's good stuff to know and to kind of, you can base things off of. Intensity needs to be between moderate and vigorous. So you're talking between 5 and 8 on the rating of perceived exertion scale. You need to know what RPE stands for, rating of perceived exertion. Pay attention to body alignment. If someone's doing resistance training and they're not doing it properly, and if their body's not in the proper alignment, then you're going to have issues potentially with injury. So pay attention, make sure that they're doing things the right way. There's some things that can also be done as far as exercise prescription to work on things like balance, agility, proprioceptive training, which is just knowing where your body is in space. Like if I close my eyes and want to touch my nose, I can do that without seeing it. That's proprioception. You can do things like standing on a single leg for time to see how long they can stay on one leg without putting their other foot down. Testing things like balance and agility, you can do that 2 to 3 days a week. Try to go for 30 seconds, eyes open, eyes closed, things like that. You can do different variations. You could look up some different proprioceptive training types as far as that goes. Power training, you start to see, like we talked about, the muscles are becoming smaller. So power training is important because loss of power also plays into increased fall risk. So to work on power training, you're going to have single and multiple joint exercises that use 30 to 60% of one repetition max, 6 to 10 reps at a high velocity. That's the key to this one, is the high velocity. You're working on power. So you want to see quick, strong movements. Flexibility training needs to be done at least 2 days a week. Static stretches, which means, holding still. You're not doing bouncy stretching to the point of tightness, but not pain. hold for 10 to 30 seconds, progressing up to 60 seconds. Again, these are all, everything that we've just talked about here are just guidelines. And it's going to differ for every person. And that's why I have held back to a degree on focusing testing on this information and more so about what's actually going on with the person. How do we know how to help them when they come in to us for exercise? That's just as important. The education on being able to talk to them about their issue is as important as knowing all of these specifics, because it's going to vary for each person. And that's why I don't really want to test on these exact numbers for the most part. Some other tips for exercise: you want to avoid strenuous exercise during hot, humid weather. You don't want to be taking them out for mountain hikes on a 110-degree day. Avoid exercise during flare-ups of arthritis or other chronic conditions. That's kind of, they'll tell you that, and they'll tell you they're not going to do it during a big arthritis flare-up, I can assure you. Encourage low-impact activities like walking, stationary biking, water aerobics, and swimming. Water is an excellent area for elderly to work out. It really cuts down on the impact and chances of injury. It's a lot harder to fall in water. It helps with balance problems and things too. You want to limit high impact activities. We talked about that. But high impact activities are even things like running, jumping, and bouncing. As bones become more brittle, higher impact activities can be a problem. Same thing with the meniscus and cartilage. If it's already trying to break down and you add high impact to it, you're going to have some issues. You also want to avoid activities associated with a high fall risk. That's common sense, and we all know that already. Now here again, this is a good sample exercise program. It's not an exact exercise program. You wouldn't want to hand this to every elderly person that comes through your door. But you want to work on upper body strength training. These are some things you can do. Chest press with elastic tubing, or lat pull downs with elastic tubing. Shoulder press with dumbbells. It's going to be lighter weight. Biceps curl on machine, triceps extension on cable machine. Now, the thing that you notice here, you see elastic tubing. You do see dumbbells, but they're going to be lightweight. Then you see machine. You're not going to be using a lot of free weights with people that are older adults. Unless they're, a 60-year-old who's been weightlifting their whole life and they're ripped when they come in to see you. That's a different situation. But for the most part, you're going to try to use less dangerous types of exercise as far as your upper body strength training. With lower body strength training, step ups, squats, calf raises, those are all good choices. Now, if you're talking about a frail senior, someone who may have been sick, who is older, and you know what frail means, warm up for 3 to 5 minutes. Notice that's a shorter time. You don't want them to be tired before you start. Seated marching, arms relaxed, is a good way to start. That's just moving just the legs. Tap toes to the front, then tap them to the side, tap heels to the front, heels to the side, and then you can add some arm movements and repeat. A pretty good exercise program for someone who's in the frail category. You're totally taking out the chance of a fall too, because we're talking about being seated for these exercises. As far as strength training for a frail senior, you want to split it into 2 sessions, 15 minutes each. One in the morning, one in the evening, if this is possible. Like I say, this is all has to be individualized anyway. You can do upper body one day and lower body another. Participants' weight might be adequate resistance, and probably will in the case of a frail senior. If you want more intensity, you can apply resistance with just your own hands. If you're having them standing up, sitting down, you could actually just place your hands on their shoulders. Elastic bands and light weights are also fine. There's different levels of elastic bands too. It seems like the yellows are real skinny and they're stretchy, and Then you've got blue, which is a real thick band, and it's for a grown man. They have it set up for almost everybody. And sometimes when you're talking about frail seniors, practicing everyday activities is sufficient. You know, they may have trouble getting up and down stairs. So step ups and step downs are actually practicing everyday activities and helping them to get some strength training exercise. Lower body strengthening exercise, some examples. Sit to stand. That's an everyday situation there. Single knee extension on a chair, single seated leg curl, seated heel raises, seated toe raises. Those are all good choices also. Upper body, chest flies using elastic tubing. Seated row, again, using elastic tubing. Lateral shoulder raises, you know, you're talking just raising your arms. Bicep curls with 1 pound dumbbells, or tricep dips in a chair. You're cutting down a great deal on chances of injury to your clients by doing things such as this. Okay, let's talk a little bit about nutrition. We're almost done. Water, obviously, is important for body temperature regulation. We've talked about how body temperature regulation is something that suffers in the elderly. So water needs to be there. A lot of times, and I've seen this in my own father, he'll go out and work all day long in the yard. He'll be running a chainsaw, whatever, and he never gets thirsty. And then he complains about getting cramps or having a headache. And I'm like, man, you just worked for 8 hours in 100 degrees and I didn't see you drink one time. And he's like, well, I wasn't thirsty. So I know that this is true. A lot of times water is deficient because of this. Seniors lose their sense of thirst, which is very strange to me because I can't imagine not getting thirsty in cases when I should be. It's also inadequate a lot of times because they'll restrict their water intake to avoid incontinence or peeing on themselves. That's obviously embarrassing. You know, you don't want that to happen. So you cut down on the amount of fluid you take in to keep it from happening. Now you combine that with exercise and then you have a recipe for disaster. So the minimum recommendation is 6 glasses of water a day. Some signs of dehydration: not getting enough water, fatigue, confusion, dry lips, sunken eyes, increased body temperature, decreased blood pressure, constipation, decreases in urine output, and nausea. Those are things that if your patient just doesn't look great when they come in one day, you might need to ask them about that. Have you been drinking enough? You know, if you see some of these things going on. Now, the first thing you ask your person when they come in probably isn't going to be on, are you constipated? But anyway, that's just a point. As far as nutrition going forward, carbohydrates, protein, and fat. I want to have a minimum of 130 grams of carbs. As far as fats, they make that 20 to 35% of the daily intake for these people. We're not going to worry about the linoleic acid right there. Protein, about 0.8 grams of protein per kilogram of body weight. And, you know, this is more information that would be used by a nutritionist, dietitian, but it is good for us to be able to give some guidance to people that are coming in to work on wellness and getting healthy. They may ask you questions about eating, so this is good information to have. Again, not something that I'm probably going to test you on here. Vitamins, B12, D, calcium, C, and E, they're all listed right here. Vitamin C, male seniors are supposed to get 90 milligrams, which is 15 more milligrams a day than female seniors should get. Otherwise, these numbers are all the same. And we have made it through. Congratulations on making it through a pretty long one today. So thank you guys. I'm going to post this as soon as it finishes setting up, and I'll see you next time. Y'all have a good one.